I'm going to show you how to take a horse's pulse and respiratory rates and how to check for lameness. To begin with, to take your horse's pulse, you want to run 2 fingers down the jawline until you find a cord-like structure that's about the size of a pencil. Here you want to count for 15 seconds, or for 15 seconds you want to count how many beats per minute the horse has. And then once you get that, you multiply it by 4. And you're actually feeling an artery in the horse's face, which is the transverse facial artery, and it's right along under the eye, and you can see there that it's skinny and it's rope-like. And you want to press up against the jaw to make sure you're feeling it. And if your horse moves your head and you lose the feeling with pulse, don't worry, just keep counting in the same rhythm. And then next, for respiratory rates, you want to stand at your horse's side with your hand in front of their nose and watching their belly. You want to count for a full minute how many breaths they have in that minute to get your rate. And a normal is 8 to 15 breaths per minute. And you don't want to count, like, an inhale and exhale is 1, you don't want to count it as 2. And then the reason why you want to have your hand on by their nose and watching their belly is if they shake or move their head and you don't feel a breath on your hand that you would be counting, you would be also watching their belly so you can see each breath so you don't lose count. And then finally, for checking for lameness, you want to check for lameness in the hind end and the front end. And for you want somebody to trot your horse for you. And for the hind end, you want to check to make sure both hips are coming up to the same level. If one hip is dropped slightly than the other, that means they're lame on that side, that leg. So then, when they're coming back towards you, trotting back towards you, we'll check for front end lameness. And if the horse is lifting their head up when a particular hoof or leg is coming down, then that means they would be on that foot because it would be sore.